Good morning, everyone. Welcome to our Community Connect for our lupus and fibromyalgia friends. I'm Melissa Tolwar from the Support Fibromyalgia Network. We are a patient-led organization focused on education, medical education, advocacy, and awareness for fibromyalgia.
Good morning, everyone. I'm Estela Mata. I'm one of the co-founders of Looms for Lupus, a nonprofit organization that provides support to those living with lupus and overlapping conditions such as fibromyalgia, their loved ones, and caregivers. So I'm excited to be here again with you guys today and bring you guys some cool updates and an amazing topic.
Well, it's Friday, and it's time for our slideshow to bring it in. Okay. There we go. So yes, welcome to our Community Connect Live. We're going to get started with some of our news and updates. So Estela, do you want to get us started?
Yes. So first and foremost, again, thank you everyone for tuning in. So this week was an awesome week. It wasn't super busy, but yet a little crazy for me. There was a lot of social media. If you guys were able to see, we had the WeGo Health Awards. I didn't win. I was one of the finalists, but I'm just so excited that I even made it. I mean, there were about 13,000 nominations, and I was one of 5 finalists for my category. And it was just amazing to see everyone celebrate patient leaders. So that was amazing. So that's an amazing update. And then this weekend, Looms for Lupus, my sister and I are going to be providing a live session through Instagram with the I Am Beauty conference. And this is for all lupus patients and just basically everyone that can come join us on Instagram Live. And we are going to be giving tips on beauty tips. And my sister's going to be doing some facials, like DIY, do-it-yourself facials, and giving you some tips and beauty tips. So I'm so excited. We're also going to have a giveaway. We're going to be giving away a beauty basket. So it has a lot of stress relieving things there, and also a beauty product. So I'm just excited for that. And that's for tomorrow. And then we also have...
What time tomorrow?
Tomorrow, it's like an all-day thing. I think it starts at 10 a.m. and it ends at 6. We are going to be live at 2 o'clock. So it'll be through the I Am Royal Instagram account, but we're also going to be obviously joining in from our Looms for Lupus. So, and the giveaway is going to be given away live. So we're going to select someone from the, I was going to say the audience, like it's a show, but someone that tunes in will get the basket. So we will ship it to them. So we're just excited because, we're always talking about beauty things and how makeup makes us feel better. But one of the things that my sister does is she uses a lot of facials and different treatment plans that she uses for her face. So she's going to be providing that. And then just in another update, we had a meeting yesterday with a representative. So let me just tell you who it was, because I completely forgot really quick. We met with Congresswoman Barragan from the Orange County District, and it was just pretty amazing to be able to discuss different things. We're discussing the Stark Law, like telehealth, telemedicine, payment for the providers, because as you know, a lot of us are still getting telemedicine visits, and a lot of the times, a lot of patients don't have the video telemedicine calls because they don't have smartphones. And, it kind of goes along with what we're going to be talking about today, health literacy and understanding, the communication between your provider and your plan and your treatment plan. So not being able to have a video conference and only having a call instead of video is not, sometimes it doesn't work for the individual, and sometimes it's hard for the provider to address it to the patient. But also the providers are not getting reimbursed at the same level. So even though they're giving the same treatment, they're not getting reimbursed. So we were discussing all about that, about health equity, health access, and most importantly, look, health literacy is one of the things that plays a huge role in regards to the healthcare access. So it was really, really cool to be able to speak to her and have her support us.
That's fantastic. And we'll be talking about health literacy coming up really shortly. I think on our side, just community updates. We had a great interview yesterday with Jason from the Discomfort Zone podcast. He has a wealth of insights to provide for us. So everyone, please check out that interview. We definitely need to have a scientific conversation and break it down. Speaking of health literacy, Monday, we have John Splain coming on too for an interview. So I'm excited about that. And for anyone interested, we are giving away a couple of passes to Garden Nerds webinar tomorrow. So if you're interested in learning about organic gardening, whether you have a small space or container garden, we are running a giveaway over at Instagram right now, but we can bring it here if someone's on and wants to join in. We're giving a couple of free passes, so please just leave a comment if you can attend tomorrow. I think it's 3:00 Pacific time, so we would love to give away those passes so you can learn how to grow your own food.
That is awesome.
Well, next up, I know we have Health Literacy Month, so I'm going to move us back to our slides over here, and hopefully this works. So it's National Health Literacy Month, and health literacy. So I know Estella and Juana definitely have been working in this space much more than I have. So I took some time to research, and boy, was there a lot of information to learn and a lot of information on the CDC websites and around the internet. It's going to be tough to put this all together, but if this topic interests you and you want to learn more, please post comments and let us know, because we'd be happy to do a part 2 when it comes to this. So what is health literacy? And the literal definition that we found from the CDC website is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Estella, how do you break this down a little bit easier for definitions?
So to me, what I really think of when I think health literacy is basically me as a patient, as an individual, understanding what is going on or what treatment plans I'm going to get, and basically, or what my treatment is going to be, or what decisions do I have to make when it comes to my health. So that to me is really what it is. So if you're informed, then you can make decisions on what you would like for to happen, whether it's a study, whether it's a treatment that you're taking. So it's just basically understanding and being able to make a decision.
And that's sort of with the talking points we started to get into of some of the examples of what we mean. And I didn't realize it was so prevalent with people walking away from their appointments, not understanding what medical information they've been provided. So I know some of the examples we included just instructions on prescriptions, appointment slips, doctors' directions and consent forms, risks and benefits, interpretation of the test results, even how to communicate with healthcare providers, and then health plan coverage information. So I know from my own just experience and then talking to other patients as well, I think the average time of a provider set, or it's like 7 minutes you have with them. I think it might be less, but when you have a chronic illness, I think we need more time with our providers to get all the information. But you had broken down some other examples for us. So how can people understand health literacy a little bit more?
Yeah, for me, and I think you're right. 7 minutes is not, the amount of time we need when we have chronic conditions. So, you want to have a plan on before or prepare before your visit. So to me, one of the things that helps everyone, and it helps myself as well, and my sister who has multiple conditions, but prepare for your visit. Write down the questions before you go in and make sure that your questions are answered. So, and also kind of jot down your concerns from the most important to the least important. I know everything's important when it comes to our health, but really the doctors are only going to address minimum, like 2 things. So make sure that whatever your biggest concern is what's the top of the list, because if you give them like your 10 concerns, it's going to be it's going to be difficult to assess. So one, prepare for your visit, prepare your questions, and also, make sure that they get answered. And when you are leaving, make sure that you understand your treatment plan. So make sure that you understand the medications you're taking, how you're going to be taking them, and then who to contact if something happens, or if something doesn't work, or something occurs while you're taking the treatment. So, I think just prepare, ask questions, and leave with your questions answered.
And there's so much to this, and I'm sure many of us have had experiences with it, but diving even into some of the impact, I didn't realize, again, it was so prevalent of understanding, but then I reflected on my own experience. So this is according to CDC guidelines, which actually, as Stella just pointed out this morning, that they need to update the website and they need to update the literature. So a lot of the studies that they're referencing seem to be from the 90s. But we do know the impact of this. So when you struggle to understand health information, you're at a greater risk of hospitalization and poor health status. Literacy impacts all the health knowledge, health status, and access to health services. And studies show that patients interviewed right after a visit with their doctor recall less than half of what they were told. So there's a lot here.
Yes, and not only this, Melissa, the impact of health literacy disproportionately affects lower socioeconomic and minority groups. And who are the ones that are in more need of this information? The minority groups. A lot of the autoimmune, illnesses do affect the minority groups, and we have seen it. And that's one of the reasons why we need to make sure that we understand what this means, and that we are also educating everyone so they're prepared and they know what to expect.
Well, and this ties into being your own health advocate, but there's a lot of barriers to getting this information and understanding this information. And I think there's even some of these trainings, but it's a lot of breaking things down. They had differences between personal health literacy and then organization. And it's given me a new perspective from an organizational standpoint of how to provide information. Because even details on like medication, like we may talk about the FDA approved medication, but we're not saying like giving even more information on how to read it. Maybe what is the recommended dosages and how to take it, like all of this information, because I just, you're inundated with it, all the information from the prescription bottles to like what you need to do or take in a handout. And do people really understand what they've been given?
Yes, not only that, not all of us have the knowledge. Like I've been in the healthcare industry, and I love, I don't love science as much as you do and get technical, but you kind of need to have an understanding of your body, of healthy behaviors, and knowing how the system works, how the health system works. So one of the things that we always talk about when we're in our support groups is obviously making sure that you take notes, right, when you're at the doctor's office, and that you know your lab results, right? So know how to read them. So not just get copies of them. So getting copies of your lab results is good. Keeping track of your records at home is also good. But understanding how to read them is very important. Knowing what your normal or what your numbers are and when they're high, because we're all different. Treatments are going to affect us differently. We're all different. So we need to make sure that we understand that. And then also, not only that, but understanding when you leave the doctor's office. So whether, like, I'm very visual, so I like to see things. So if the doctor's going to tell me we're going to do, this procedure, I need to kind of have an image drawn for me and explained of what they're going to do, what the process is going to be. So don't feel like, you're being a burden to the doctor if you ask them for more details, or even ask them to give you a drawing, or, write it down for you, or give you a handout. Because that's really what we need to understand. And that's really what health literacy is understanding what's going on so you can make better decisions, right?
Right. And I looked at some of the organizations you had pointed out. I mean, there's so much to this, and it can be a lot. It brought up memories too. I had a surgery, and I had to get there at like 6 a.m. and they're having me sign forms, and I'm like, what am I signing? Brain fog. I'm not going to be awake at 6 a.m. No one was with me. So what am I signing? And I didn't ask questions. So I think this really gets into more of like, what are your patient rights? Like, what can you take the time to do? I should have probably done that more in advance, not at 6 a.m., knowing that I'm going to be half asleep and I wasn't able to drink coffee or anything before a surgery. So but it's okay to ask those questions and letting patients know you have rights. So don't be dismissed and shoved out the door. You may get dirty looks but like you do have your rights, and you have, as your own healthcare advocate in these positions, you can say something. And I don't know why we tend to feel like a burden, or we don't want to bother people, and it takes more time when they're trying to rush you through. So it's important that we have these discussions.
Yes, and what's important for us as patients, but also it's important for the providers. So a lot of times, if the providers encourage us to ask questions, or the nurses before we leave, or the medical assistant when they're taking our vitals, I think that's essential. So, when I was 17 years old and I went to medical assistant school, one of the things that they asked us is, when your patient comes in, ask them what the reason for their visit is, right? So you put in the reason for visit. Then you ask the question. So if we knew that a patient was complaining of like maybe a urinary infection or like issues like that, we would know to ask like, how long has it been? Does it burn? Does it this? So you kind of need to, as a healthcare provider or as an organization, learn how to make it easy for the patient to give you the information. And when it comes to like organizations like ours, I think including the patient's perspective, right? We've been talking about, and Wigo was talking about having the patient hold a seat at the table, and that's really what it's about, and that goes through with when you're talking about, making sure that everyone has equal rights as a patient, whether you're brown or you're white or whatever color you are, whatever race, gender identity you are, you should be treated equally, right? So I think that we need to ensure that everyone feels safe, that everyone feels that they are being heard and that they are being treated, right? Regardless of what it is, and included. So whether it's information we're handing out, making sure patients look at it, review it, give their feedback, because you have to know your audience. You have to know who you're handing this out to, and they have to be able to understand it. And it's a way beyond just your cultural background, as they say, right? It's way beyond that.
It's great insights. And I think we need to have more open discussions on building the provider-patient relationship back. I think, especially in our communities, there maybe have lost some of this relationship. And I know doctors, they've gotten into the business to help people, and it gets overwhelming at times. So we have to have some empathy towards them. But how do we build back this great relationship with our providers so that we have an understanding of what's going on with us, and they're able to take the time to do that? But it's also this trust and build back. So I think you've just dived into a whole separate video that we're going to have to do on trying to mend this relationship. And I think fibromyalgia especially, we might have more of a cynical perspective on our provider relationships.
Yes, exactly. Yeah. I mean, there are all of the topics, and I think all of the discussions we're having, not a lot of people talk about these things. A lot of people feel, if they don't understand something, they walk out from the doctor's office not understanding what their treatments are, right? So I'll give you an example. If I need to get an MRI, right? So I leave, the doctor tells me you need an MRI, schedule it, right? I don't know when I need to schedule it by. I don't know what the MRI is gonna show, right? Why am I having an MRI versus the CT scan? Is it gonna be with contrast, without contrast? Am I gonna have to be able to eat before, not before? How do I prepare for it? And how is this gonna help resolve what issue I'm having? So, I mean, a lot of times we're embarrassed to ask, right? So you leave without knowing and understanding what's going on. And we shouldn't be embarrassed, because it's not about, what you know or what you don't know, right? It's about understanding what it is that you are going to be getting done, and what your treatment and how is it going to impact your health. And really, that's really what it is. And whether it's the doctor giving you simple terms, or simple instructions, and you not understanding, or whether it's very complex and you think you understand it. I think the one thing is, communication is understanding that it's okay to ask questions. It's okay to say, you know what, I don't get it. I don't understand. You know,
Right.
a lot of the things, also with the health literacy is payers, right? You mentioned payer information. How do you know the difference between a PPO plan and an HMO plan? So the doctor says, I'm going to refer you to a specialist. You think, okay, I'm going to go schedule my visit, right? Well, oh no, wait, if it's an HMO, you have to wait for the doctor to submit the referral. So then the health plan then has to approve it. Oh wait, but they might get it denied, and then you're still waiting for your referral or your authorization. And then, oh, maybe you only had a 30-day window. You call your specialist, and oh my gosh, your authorization is not valid. So there's like a huge issue when it comes to understanding, which is also part of health literacy, understanding your payers, right? Understanding what gets paid, understanding what's your responsibility as a patient, and what's the responsibility of a provider. So, I mean,
Oh,
it's
and
a lot.
yes, it's a lot of information. And I know last video you mentioned the organization mypatientrights.org.
Yeah.
So I had pulled up the list they have, and I was like, oh my goodness, because they have adverse tiering, co-insurance, continuity of care, copay accumulators, high deductible plan, non-medical switching, out-of-network charges, prior authorization, step therapy. I was like, wow, that's a I don't
mouthful.
well, none of us are experts in this field, and to try to work with patients, because we're patient led, so we're right there with the patients. And I was looking at this, I was like, that's a lot of information to know.
Yeah. Yes. And you know what? You bring out an amazing point. So yes, mypatientsrights.org, and knowing your rights as a patient is super important, because again, we're talking about understanding your treatment plans, right? Which involves you, the patient. So I think, and maybe this is just thinking big, but I think we probably need to discuss these terms. Like, what is step therapy? Like, do you know what step therapy is? Some people don't. Step therapy, it's like, okay, we're going to try this treatment first because this is what your insurance pays. Wait, it might help you, but it might not help you, but we have to try this first in order to give you this other treatment. So do you really want to be that little guinea pig to test to see if this is going to help you, just because your payer is not wanting to pay for that other treatment because they want you to try this treatment? So it's important to understand that. So not only that, if you don't get the treatment that you need and that you should be getting, right? If you get denied treatment, or you have the right as a patient to say no, like, this is not right, and report that agency. Now, we had this huge issue, a long time ago, when my sister wasn't given a treatment. And she wasn't given the treatment, and it wasn't because they didn't want to give it to her for whatever reason, but it was the way it was delivered to her, which is, again, how the doctor communicates to their patients, right? You don't say to a patient, oh, we're not going to try that treatment because it's too expensive, right? You don't say that. What does it mean? Like, I'm not worth that treatment? So those are the things that you don't want to hear as a patient. And you have the right to say, hey, why are you refusing this treatment for me? So yeah, that organization is out there. So if you guys ever need anything, it's out there. And, we could even bring Liz on, one of these days so she could talk more about it and kind of maybe discuss, what the step therapy is, what your rights as a patient are. When we go to the doctor's office, the first thing they give us is what? Privacy rights, right?
Yeah, but do we really understand what we're signing?
We don't. And guess what? If you don't sign a lot of these, or like in an arbitrary agreement, you don't get seen.
Well, and with brain fog and we're walking in, I mean, I already have trouble filling out all the forms with my hands. So it's like by the time I get to those in the clipboard, I'm like, and
I know, it's like, just give it to me so I can sign it fast, and then we could just see the doctor and then I can leave, right?
Especially if you waited months to see a particular provider, you're like, I just want to get seen. So I'm just going to fill these out and sign this off. And okay, I don't know what I just signed away. Maybe I signed something. I don't know, my organ system. I don't know. So it's like,
right. You signed away your life.
So it's good information to have. And this is such a good conversation. So it'd be great maybe we should set up a roundtable discussion with other people in this area and or like you said, let's put together more terms for everyone. So if you're out there, you're watching and you'd like to learn more, please share with us, please post your questions, because we'd be happy to share with you and learn with you as well. Because some of these definitions I'm not completely 100% literate on as well. So I wouldn't be able to talk about it fluently.
Yeah. And, and a lot of the, whether they're bills or health access discussions that are held, they all include all of these terms. And a lot of the times we're excluded from all of this. The patient is excluded from understanding and or even having a voice as to, how these decisions are made in the healthcare system. We don't know. So it's very important for us to, self-advocate, to advocate for ourselves, right? So understanding what it is that you need and understanding how it's going to be delivered to you, right? So for providers, please use plain language when you're speaking to us patients. Not all of us know all these technical terms. Also, organize the information when you're handing it to us. A lot of doctors don't have electronic health records, so I may leave the doctor's office without my plan of action or a summary of what was discussed and or what my treatment or what comes next. So making sure that you take notes. If you cannot take notes or you have the brain fog, whether if you have lupus or fibro fog, take someone with you and have them take notes for you. And then also for providers, please break down the information for us, right? Don't give us the complex information. Don't give us like a big, huge words and everything. So give us everything in tidbits so we can understand what's going on, and use simple language for these technical terms. So those are the tips that I have for the provider. And for us, like I mentioned earlier, just, make sure you take your notes, prepare for your visits, ask the questions, and before you leave, make sure your questions are answered.
Well, we appreciate having this conversation. So if everyone would like to learn more, please let us know, because we can definitely have a part 2. We try to keep these to 30 minutes. So I think we tried to get a topic that was way past 30 minutes.
Yeah, but you know what? The important thing, Melissa, is that we're starting the conversation, right? This is going to spark someone to say, hey, what is health literacy? Like, do I really understand what my treatments are going to be? Do I really understand what my insurance covers? Do I really understand who I can go to? And if I don't understand, then who do I go to help me? And I think, it's a good topic to start a conversation with.
Well, it got even me thinking. So I was reading through, I was like, wow, okay, this is good information for me to even acknowledge and know. So yeah, it was super helpful. I mean, I'm so grateful to Juana and Estella for bringing up this conversation and topic. So we ran with it, and we'll have to do a part 2. So I know, Estella, you got to run. So let's say bye to everyone in our fibromyalgia and lupus community. Happy Friday. Please enjoy the weekend and check out again. Where can they find you this weekend, Estella?
We are going to be on Instagram Live at 2:00 through the I Am Royal Instagram, and also the Looms for Lupus. We will be giving beauty tips. So we hope you can join us.
Thank you so much, everyone, for tuning in, and we will talk to you later. Bye.
Bye.